Common exercises to do if you have a shoulder pain. If you experience a shoulder pain, you should do a rehabilitation that includes the muscle around the shoulder joint. What are the important muscles and what are the actions which we should focus on? There are most important muscles, the rotator cuff muscles, which includes subscapularis, supra, infra and teres minor. Along with that, we should focus on periscapular muscles. That includes deltoid, that includes trapezius, rhomboids and latissimus dorsi and serratus anterior, and pectoralis to the extent. If you have shoulder pain, you should focus on these muscles. The first muscle, subscap. Subscapularis is a strong internal rotator of the shoulder. So for that, we should do an internal rotation exercise in which we can hold a dumbbell in our hand, which is like 1 kg or 2 kg dumbbell, hold it and do it with the help of by keeping elbow tucked onto the body. Okay, you can use your red color TheraBand, where one end of the TheraBand is attached or fixed to the window or the bed end, and you can use it with the help of other end of the TheraBand. Second important rotator cuff is the external rotator, that is supraspinatus and infraspinatus teres minor, where you do a reverse exercise in which you hold the dumbbell and your elbow is stuck into the body and do external rotation exercises, in which you can use a red color TheraBand where the other end of the TheraBand is fixed to the bar, and with the other end you should kind of do external rotation strengthening training. These are the two important rotator cuff exercises. Third important muscle is the deltoid muscle. Deltoid muscle is divided into three parts. So one is front, one is side and one is posterior deltoid. For the anterior deltoid, you can use a light dumbbell, do in the front of the shoulder raise exercises. For the middle, you should do a middle raise exercises, and for the posterior, you can go from the back and do it back shoulder or posterior shoulder rehabilitation. Third thing, trapezius. For trapezius is a primary scapular elevator. So if you want to do a trapezius exercises, you can hold dumbbell in your hand, which is relatively heavyweight dumbbells, or you can use a TheraBand where the other end of the TheraBand is keeping inside the foot or below the foot, and you can hold the other two ends of the TheraBand and you can just elevate your scapula. So this is an important muscle because trapezius is a scapular stabilizer muscle. So if your scapula is well stabilized, the impingement kind of symptoms are very well taken care of. Another important muscle is your rhomboids and latissimus dorsi. For that, you fix your TheraBand to the other end of the bar, and you can hold the two ends of the TheraBand, and you can pull those TheraBands to the back side, in which we are focusing on the back side of the muscle, that includes your rhomboids muscle. If you do it on the front to down and focused on the back side, which includes your latissimus dorsi muscle. So you can do these exercises at home, but you need to fix your TheraBand to the fixed bar at different level. If you keep it at the eye contact level, it will more focus on rhomboids. If you keep it at a higher level, it will more focus on your latissimus dorsi muscle. For pectoralis major, you can do a push-up exercises, or sometimes you can, with the help of TheraBands, we can keep a TheraBand on the back of the shoulder and just push the other two ends in the front. So this will focus on your pectoralis muscle. So these are the common muscles which are nearby to the shoulder. Along with that, you can add abduction exercises and forward flexion exercises. This is a forward flexion of the shoulder and this is the abduction of the shoulder. Both exercises you can do with lightweight dumbbell and regular therapy. If you have a shoulder pain, please keep those exercises. That is the most important treatment. And for further knowledge, please visit to the office. Thank you.